Hello, everybody. My name is Dr. Michael Doty with Doty Chiropractic in Littleton, Colorado. Today, we are going to talk about acupuncture basics. And our guest today is Julie Odler, and she is a licensed acupuncturist who is working at the clinic and a former personal trainer, actually certified strength and conditioning specialist, who specializes in working with active people over the age of 40. Her passion is blending Eastern and Western approaches to heal in practical and, to use a buzzword, functional manner. She's here to tell us a little bit about acupuncture and Chinese medicine, and what most people don't know about acupuncture and Chinese medicine. So first of all, let me welcome you, Julie.
Thank you. I'm glad to be here.
Awesome. Well, I'm glad to have you, because I know there's going to be a lot of really great questions that are going to be answered for people. And, you know, with acupuncture, there's a lot of misconceptions. So let's just dive in. And why should people consider it? Can you give us a little background so people can make really an informed decision on and know where to start?
Absolutely. Yes. And we're covering a lot of territory here, but the idea is to make it as simple as possible so it's not overwhelming for people. So we're going to do a little nutshell approach here. And also talk about what you really need to know. It's really common to go on acupuncture websites nowadays and just see all kinds of things about qi and meridians and how the theory works. But then you are sitting there thinking, well, okay, well, my knee hurts or I have a headache, so how does this apply to me? So in a nutshell, and you may have heard this before, it's withstood the test of time. And basically what that means is that you'll often hear people say, well, is it science-based? Is it evidence-based? And that can be done with the scientific method, creating a hypothesis, testing that hypothesis, and coming up with a theory. And those are great. Double-blind studies are fantastic. It's a fantastic way to test new products, new drugs. But what people also don't realize is that when you're practicing medicine, double-blind studies are helpful, but also knowing that somebody's used a particular herb or herbal formula for years and years and years is also considered evidence. And it's part of evidence-based medicine. So for example, if someone has been using an herbal formula to treat a common cold for hundreds of years, generally speaking, we pretty much know it works. So I just want to differentiate between doing double-blind studies and actually practicing medicine. The second thing is that it's simple, it's elegant, it's non-invasive, and practical. So what does that mean? I'll give you an example. For instance, knee pain. If you have someone that comes with knee pain, something that wouldn't be simple, elegant, non-invasive, and sort of impractical would be getting numerous tests done over and over again to see if knee pain requires surgery or an MRI. Now, those are pretty expensive tests, and it's pretty much, you're kind of jumping ahead. There are some conditions that I've seen where I do actually want people to see an MD first. But in the case of knee pain, especially if we're suspecting that there just might be muscle pain or something we call trigger points, it seems so much more logical to treat that first, to do some acupuncture, maybe get some ART, active release work done, some chiropractic. And if that works, then you know you don't have a problem, rather than jumping right ahead to the MRIs and the surgery. I do want to qualify that, though, because I've had shoulder surgery before. So it's not like we're saying, oh, it's either or. Nobody should ever go to an MD or get an MRI or have surgery. It's just kind of knowing where to go first. So it's simple, elegant, non-invasive, and practical. Even myself, I'm surprised how well it works. Even I am, yes. And the third is that it works really well for treating chronic conditions. I think a lot of people have heard this before. Let's see, for example, a chronic condition, like somebody has chronic migraines. It might be acupuncture has a tendency to have a better track record for treating that than opposed to something that has an acute onset or something that comes on suddenly. That's where Western medicine shines. It's treating more acute or emergency type of situations. And we'll talk about that a little bit more later. It's becoming demystified. Here's the fourth reason why acupuncture is a good thing to check out. Gone are the days, although you're still going to see this a lot, where you'll see on websites people saying, oh, it's Qi and meridians, and explaining about Chinese theory with lots of pictures of needles and bamboo. I think a lot of Westerners aren't really responding to that, and I don't think I would either. So there's a lot better information out there. So this is a better way that you can communicate with your doctor if you need to ask your doctor about acupuncture, which brings me to the last point here in a nutshell. It's good to know, it's good to have good information now about acupuncture or chiropractic, because the truth is some MDs are informed about it and even excited about it, but a lot of them are not going to be. And this doesn't mean they're bad people. It just means that that's not what they studied in medical school. A lot of them didn't study muscles or the nervous system or the spine that extensively, or nutrition for that matter, in medical school. There are other things that they had to focus on. And now with the way that the practices are being run, there's so much for them to do that they're not going to have time to know everything. And so it pays to educate yourself, as with anything in regards to health, so that you're working with the best choices that you have.
Yeah,
possible.
absolutely.
Yeah,
absolutely. Yeah, it's kind of interesting how you talked about it. It's becoming demystified, and the fact that it's been around for thousands and thousands of years, yet now science is actually showing a lot of what they knew so long ago on how to treat the body and what the meridians and the Qi are really all about. So I think it's really cool that it's kind of doing both. Can you give us some myths and misconceptions that you see out there then with all of this stuff that's kind of changing around acupuncture?
Absolutely. Absolutely. So there's a lot of common misconceptions about acupuncture that are still running around out there. And I just want to say too, I don't blame people for having these misconceptions. It's not like their fault. It's actually our responsibility to make sure that we're educating people and telling them about these things. The first one, and you might have heard this before, Dr. Doty, it's only good for treating pain, right?
Yes,
Have you heard this one before?
Absolutely.
Yes. So, well, the truth is, and I'll get to this in a moment, I'll give you a whole list of conditions that acupuncture can treat. The second one is that you need to believe in it for it, in order for it to work. Although I do want to say there is some truth to this. And what I mean by that is anyone who comes in for any kind of treatment, whether it's surgery, chiropractic, acupuncture, hypnosis, anything, if you go into it with the right attitude, you're going to come out of it a lot better than if you go in there and say, oh God, well, I don't think any of this stuff works. I think I'm screwed. I don't think my back surgery is going to work. We'll try this antidepressant pill. I'm not sure. Chiropractic, or prove it to me. That's cool. I understand it to a point, but you have to kind of don't you agree that you have to have
definitely
a positive attitude?
I would agree. I mean, there is definitely the idea of believing, I understand what you're saying. You don't need to believe in it for it to work, because you're doing things with the neurology and anatomy, physiology, but mindset's huge.
The mindset is huge, right? And having said that, you've done work on children. I know in acupuncture, I'm not sure about chiropractic, but we actually work on dogs and
Absolutely.
animals too. So, and they respond very well to it, and they don't have any preconceptions about it. So there's that part. The needles are painful. Well, what do you think? Are the needles painful?
That's not been my experience. I mean, definitely there's times where, if the spot is there's something going on there, it can be sore, but it's not painful, and it's not like a sting or what you would think from needles, because they're so thin.
And so you're speaking from personal experience,
Yeah,
right?
absolutely. Yeah.
With my needling technique. So I actually strive to have a very gentle needling technique. I've used very fine gauge needles. The needles are very small. So my goal is to have it be a pleasant experience for you. And hopefully Dr. Doty can attest to that.
I can.
Okay, and I'm sure you've heard this one before. It's expensive.
Mhm.
What is expensive? Let's define expensive. I think it's a lot more expensive in the long run to pay for expensive diagnostics, pills, anything that's reactive instead of proactive in terms of medicine. But I also look at how much money people spend on expensive dinners and cable TV, and it's not for me to decide what a person's priority is. But when someone says that it's too expensive, I usually think that if someone's priority is only spending a $10 copay per month on their health, it's kind of interesting to me.
Yeah.
And we have that discussion. Well, what is your priority? What is it that you're really looking for? What is it that you really want? I wanted to ask you what your take is on that.
In my experience, I know that a lot of times, when you ask somebody, what is your most important asset?
Mm-hmm.
And, if you really break it down, what really is our most important asset? And it's our health, right?
Yes.
So if we don't take care of ourselves and take care of our body and it ends up breaking down, then it doesn't matter what your goals or your dreams or whatever you want to do. The only thing that you can think about at that time is regaining your health. So when I look at, is it expensive? It's not really a cost. It's more of an investment in the idea of investing in what your most important asset is, which is your health. That's my take on this.
Yeah, and I have that on the banner of my website too, come to think of it. But it's so true, especially when you start getting to be 50-ish years old, you start to realize, I really want to do this and I want to do that, but I better make sure that I'm still able to do all these things 10 years from now or 20 years from now. It really starts hitting home.
Exactly.
So anyway, yes. The next thing is it's not an advanced form of medicine. Actually, I talked about that before. It's advanced in terms of its simplicity. I'm not going to go too far into this because I have a huge textbook in front of me on how Chinese medicine works, and that's not really the goal of this webinar. But the truth is, it really can do a lot of amazing things. The next is that this is a good one. It represents an Eastern religion, or that it's voodoo. Yeah. You'll get this every once in a while. I don't really run across this very often, but the way all acupuncturists are different. We all have a different way of doing our work. Some people are more 5-element, and you walk in and they're treating more emotional things, issues on a spiritual level. You walk in and it's candlelit. My approach is a little bit more Western, the ways most of us are used to thinking in Western terms. But I've also had a few patients that have come in and that are very Christian. And if you're using a mind-body connection, there's nothing wrong with using your own form of prayer to help you heal.
Absolutely.
So if somebody wanted to come in and lie on the table and do that, I encourage that too. So there's actually no religion or voodoo attached to this.
And once again, getting into the idea of science behind that is the idea that they're really showing there really is no separation between the mind and body, and that a lot of things that are happening mentally, emotionally are affecting us physically. So that's what they're finding now, even in scientific literature.
Yeah, and thanks for bringing that up. That's absolutely true. Absolutely. And the last point, the last misconception is that healthy people don't need it, but I like to use the analogy, and you're going to see some more car analogies coming up, is that that would be to me like saying, well, my car is running very well. Why do I need to get oil changes?
Right. Yep.
I'm going to leave it at that.
Perfect.
So those are myths there.
So what you talked a little bit about some of the conditions that acupuncture treats, what are some of the conditions that you treat?
Okay. Here's a list for you. This is the short list.
Wow.
So I'm not going to read these off to you, but does this look a little bit like chiropractic as well? A lot of
Oh,
people
absolutely.
think, oh, it's just back pain, hip pain, right? It's more than that.
Yep.
Hmm. And there's a reason for this too. I remember recently reading, someone was saying, well, this acupuncture they're selling it like snake oil. It's the cure for everything. But here's why. Acupuncture isn't like some magical thing. Oh, it heals PMS, it heals back pain, it heals all these different things. But it does this because most diseases are caused by, and you've probably heard this before, inflammation, um, imbalance in homeostasis, which means if your pH levels are off in your body, blood pressure is all about homeostasis, and pain. You'll see on the bottom, I put addictions down here, but basically the reason you can treat all these different conditions with acupuncture or other modalities is because of these right here. You're treating inflammation. And if you want to know more about these, you can look at my ebook on how to get the most out of acupuncture, which I'll talk about later. I'll get more into the mechanisms of how acupuncture actually treats pain or inflammation or regulates homeostasis or helps with addictions.
Awesome.
So,
Yeah. I know that inflammation is a huge thing right now in medicine, whether it's Western medicine or Eastern medicine, they're showing that many of those chronic conditions, heart disease, cancers, things like that are all linked in some way to inflammation.
yep.
So it's really pretty interesting that way. Can you tell us a little bit about your philosophy about wellness and functional medicine that you talked about earlier?
Yes, absolutely. I'll get to the fun part. So I'm sure many of you have heard the term wellness. I know you use the word wellness in your practice, but often we see pictures like this, the usual wellness cliche. I think wellness is an excellent term, but I think a lot of people forget what it means. And I just want to kind of reinforce the connection to what the term wellness means. And maybe I'll ask you a few questions about this. So if you're sitting here and you see the word wellness, does it mean better performance? For some, it could mean that. Or does it mean just not being in pain or having normal blood lab numbers? So how would you define normal? And I want to stop here for a moment. There's, for example, thyroid conditions, people that have hypothyroidism. There's a certain number where you're considered in a true state of hypothyroidism. But if the numbers are a little bit lower, I can't remember what the exact number is, you're not considered to have hypothyroidism or even have a problem with your thyroid. And now there are studies showing that if you have subacute or subclinical hypothyroidism, you're more likely to actually get full-blown thyroid disorders. And Western medicine is starting to recognize this. So I wanted to ask you what your take is on that, what you think about that. Have you seen this also in your clinic? So I think this is a common problem, that Western medicine only sees something as being a problem if it's full-blown.
Yeah, or outside of what they consider normal or average.
Mm-hmm.
Oftentimes, like, I absolutely get what you're saying, because, let me give you an example. Let's say you go out to eat, with somebody, and later on that evening, all of a sudden your stomach kind of feels upset and you vomit. And is that healthy or normal?
Right.
Now,
Right.
some people would say, no, I'm not healthy. I'm sick because I'm throwing up. But if there was some kind of food poisoning going on and your body didn't want that toxin inside you, so it expelled it, that would probably be a healthy thing for your body to do, wouldn't it?
Right.
Yeah.
And detoxing is another good example.
Exactly. Yeah.
Detoxing. Yeah.
So the idea of how do you, what is normal? That's a great question, because normal or average. And, even let's take blood pressure.
Mm-hmm.
They say, the normal blood pressure is 120/80. Now, when you exercise and, when you check your blood pressure, what is it at that point? Probably not 120/80. I'm sure it's, elevated, but that's because the body needed to elevate the blood pressure to help you during exercise, keep blood pumping around for the muscles and all that stuff. Or if there's something going on in the body where it needs to elevate the blood pressure slightly to help, make sure that the flow of blood is going through the body as efficiently as possible. Is that normal or is that abnormal?
Exactly. That's a really good point to bring up, because the homeostasis, I have low blood pressure, which is considered normal, but it's generally like around, I think last time it was 101/50 something. And I was giving blood and I was told, oh, that's excellent. You have excellent blood pressure. But after I gave blood, after the needles were taken out, so I know it wasn't needle shock, I passed out.
Yeah.
And I had to wait a half hour for my blood pressure to get back to normal.
Yeah.
So the things that we think are normal, our body kind of knows what it's doing, and it's constantly making these adjustments, right?
Exactly.
About homeostasis.
So I agree with you. It really, really depends on how you define normal.
How do you define normal? And I'm still looking for those thyroid numbers. I think the number was 2. The TSH level, when it gets to a certain level, now you really have to monitor and look to make sure that your TSH levels don't get to that point where you're considered in a state of hypothyroidism. And that takes a little bit of work. Takes a little bit of monitoring and personal attention to look at those numbers, rather than just waiting until all of a sudden you're in hypothyroidism, or all of a sudden you have diabetes because your fasting blood sugar, your blood glucose levels have gotten to that range. So, right?
Exactly. Yeah.
Yes. So normal. Here's a nice little illustration on how we would describe what is normal and what isn't. Wellness and normal. It's a lot easier to be proactive. I know you used an analogy about applying the gas and applying the brakes.
Yeah.
So say you're heading toward really high TSH levels because your adrenals aren't functioning, or you're in a pre-diabetic state. I know now Western medicine is using more terms like pre-diabetes. You're in a pre-diabetic state or pre-hypertension. But generally speaking, if your car hasn't driven off the cliff, you're not acknowledged as having a problem. So
yeah, right.
Is it easier to tap on the brakes rather than have this happen? It's a lot easier to be proactive than reactive.
Absolutely. That's what, and I mean, I think that's the big idea with, the philosophy about wellness is, what can we do? And I kind of laugh at the terms pre-diabetic or pre-hypertension. Aren't we all pre-diabetic? I mean,
Yeah.
I mean, in that sense, I mean, I might not have diabetes, but I could at any point in time be pre-diabetic. So
Exactly. And also cancer.
Yeah, absolutely. Yeah, that's the big thing.
At any point in time,
funny.
We all have cancerous cells in our body, but is the body doing its job to make sure that those cancer cells don't get out of control? Yeah.
Yeah, absolutely.
So,
no, if you're talking about a chronic condition, like you looking at this car crash, what if your car has already been crashed? What do you do then?
Okay, glad you asked. So now we're looking, there's still hope. Well, first of all, the chronic condition, this is what it would look like, the chronic condition, if you're neglecting your health. And it's amazing how so many people take care of their cars, but they don't take care of their health. So, like I said, it's really important, like you're saying, if you have a chronic condition, what do you do? Well, the first thing that you would do is make sure you don't get to that point. You want to take care of your car. You want to make sure you get periodic maintenance. You want to make sure you're getting oil changes. But if you do get to that point, there are steps that you can take, and there is still hope. So it's not like any practitioner is going to say, you're too far gone, there's nothing else we can do for you. Like, for example, people that are experiencing chronic fatigue or fibromyalgia, they might be used to hearing, oh, well, there's nothing wrong with you, or there's nothing we can do. It's all in your head, right? So,
Absolutely.
yeah, the steps you can take. First of all, you want to find out what is actually causing it. And this takes a little bit of work. So it takes a little bit of commitment and a little bit of work. You don't want to just treat the symptoms, and many of us have probably already heard this before. If you have a headache and you take ibuprofen or you take an Advil, you're treating the surface, you're treating the symptoms, but you're not getting to the underlying problem. From a more in-depth description would be peeling the onion.
Mm-hmm.
So we're looking, like, say somebody has that headache, you're looking at the onion, you're looking at the outer, that purplish skin on the outside of the onion. That's your head pain. But you can take the pill for that. You're not going to get into these deeper layers, which also takes a little bit of work on the part of the patient. It takes a little bit of work on the part of the practitioner to figure out what's going on. If you look a little bit deeper into that onion, the next layer, it could be tight neck and back muscles, stress and poor sleep. But if we go even a little bit deeper, hello, is that Abigail?
It is.
Hi, Abigail. We have another guest.
She's joining us to peel away her onion.
Yeah, I bet she has a lot of questions too. So anyway, if you go a little bit deeper into this onion, there might be some things that you would never discover, like poor liver function, toxicity, hormone imbalances that might ever get detected unless somebody actually does a blood test. They might just assume, oh, I'm getting old, I'm stressed out. Or they might even, in the middle of this onion, you might have somebody who have had a pretty major past trauma that hasn't been resolved. So with our medicine, we can kind of deal with all these things, but it takes a little bit of time and it takes some commitment. So, and as you know, yes.
You know, and I love that picture of the tree with the roots, because, you know, we often talk about getting to the underlying cause of the problem instead of just covering up the symptoms. And I agree wholeheartedly with that. And I mean, in my practice, use the onion analogy consistently, because it is true. I mean, we have layers and layers of things going on. So that, you know, that's really what's kind of going on. You know, and Abigail joined us here. So she was just asking, what is a treatment really like? You know, because, you know, people tend to be scared of that. So can you tell us about what an acupuncture treatment is all about?
Absolutely. I love questions like this. I'm going to skip this slide because people can read that later. There's a lot of things that are involved with the functional acupuncture. It gives you a little bit of idea how I would actually treat, what it's going to look like when you actually come into my office.
Yeah, and you went over quite a bit of that
yeah.
already too, so that makes sense.
Mm-hmm. When you come in, so Abigail, when you come into my office, you want to have a nice experience, right?
She was talking to you.
You want it to be fun. You want it to be a place that feels good when you walk in. You don't want to feel like you're walking into a doctor's office, which can be pretty scary, right? So you want to have a place where you feel comfortable. I say somewhere between a spa and a physical therapy experience. So it isn't just about coming in and just like when you go to a physical therapist's office, they're not really concerned about getting you relaxed or finding out what's going on, how your day was, and if you're under stress. But we try to do all of that here. It should be an opportunity for people to relax and unwind, to become more aware of your own body. By lying there on the table and having a conversation, you might have some light bulb moments and to discover things you might not have even thought about before. It should be an educational experience. I always give people homework. And it should give you a sense of community. And sometimes, if we're doing community acupuncture, a sense of community in a group and healing atmosphere. So Abigail, if you were to come in, I'd want you maybe even to have a little bit of fun. I would be, if you ask me questions, like you can ask me a question right now if you want. That would be cool. I totally welcome that. I want you to come in and
Question.
you would have.
What the needles are like.
Oh,
What are the needles like?
what are the needles like? Well, first of all, that's a really good question, Abigail, because I have a few patients that I don't even use needles on. You believe that?
Wow.
And I some
kinda
kids.
cool.
Yeah, with kids, I have a little device I can just use. It's not even a needle. I also have a couple of grown-ups that don't like needles at all. They just won't use needles. And you know what? I respect that. That's okay, because I have other things I can use. I can use my hands. So I do some active release work, which means I'm doing kind of a massage and kind of a little bit of stretching. I have liniments. Did you have another question?
She was just, she liked the idea that all those different things on there,
Yeah.
all the different pictures on the slide.
Yeah, and there's heat therapy that I use. If, for example, sometimes I'll put needles in someone's back and then I'll put like a little heat lamp right on your back, so it feels really, really good. But a lot of times I don't even use needles. That's a really good question. Really good question, because a lot of people are scared.
So, Julie, kind of, we're about the half-hour mark. So, just to wrap this up, where can somebody find out more information about acupuncture and about yourself and what you do?
Gotcha. Thank you for asking. Well, first of all, when you come to any acupuncturist, before I tell you where to find me, you want to make sure you're finding somebody who's qualified. That's like baseline. Find out what kind of focus they have. If it's a narrow or more of a broad focus, if they have experience in working with someone with your condition. Like I'm really good with working with back pain and hip pain, but someone else might have more experience working with women's health issues or kids. So you want to find someone you feel comfortable with.
So when you mute it, you can't hear me.
I can hear you. So I just want to say thank you. And if you want more information on acupuncture in general, to find out how my process works or about techniques that we use in our business, in general, just finding out a little bit, going a little bit deeper than we've gone with this webinar, I invite you to come to my website, which is littleton-acupuncture.com, and there's a free ebook. If you scroll down a little ways, there's a book called How to Get the Most Out of Acupuncture, and it's a handbook for new patients. And it'll give you a lot of extra information. It'll go a little bit deeper than what we've discussed here in the webinar. So hopefully that will help you. Do you have any more questions?
No, I think that'll do it. I'm excited that they have the ability to find out more with the ebook, but I really appreciate the time, and Abigail wanted to say hi.
Hi, Abby.
But thank you very much for your time, and I hope that people got some really good information out of this. So I really, really appreciate you taking the time to do this.
Okay, my pleasure. I'm glad to be here.
And they can find out more information right there at littletonacupuncture.com. And so if anybody wants to find out more information about what Julie does about acupuncture, and we can find out that right there at the website, and Julie can help you out. Thanks again, and hopefully we will be able to talk about something more in depth on acupuncture sometime soon.
Cool, love to.
All right, have a great day.
Bye, you guys. Have a good day.